We are on air. Hello to everyone. My name is Dr. Nachum Kowalski, and I have the honor of being the moderator today on the SleepASAP webinar. We have a number of guests, but I'd first like to say a few words about SleepASAP. SleepASAP is a new global community established by an international team of experts from multidisciplinary fields. We have come together in order to both promote awareness and to provide effective and affordable alternative solutions for sleeping disorders. This is beyond pharmaceutical drugs. This is beyond other potentially invasive procedures. There is a lot that can be offered, and we want to discuss those options. I'd like to take a moment to introduce our two very special guest speakers. The first is Glynes Mewton, who is from North London, not Ontario, but I'm Canadian, but in England. And she is a multidisciplinary therapist. She is a specialist in sleep issues, stress management, and a long list of other things, all speaking to her truly broad skill set. I'd also like to introduce Dr. Jonathan Kushnir, who is a clinical psychologist. He's a member of the Israeli Association of Expert Cognitive Behavioral Treatment. So, thank you. I'd like everyone to, if I may, Ms. Mewton, Glynes, may I ask you just to say hello to all the listeners?
Hello, everyone, and thank you for having me today.
It's an honor for us. Dr. Kushnir, if you could just say hello to everyone.
Yes, hello, everyone. I hope everyone are well.
Thank you so much. We actually have a number of questions that we would like to go through, and I would very much appreciate Glynes's and Dr. Kushnir's responses, and really feel free to express your opinions. We really have a community that wants to hear what the experts have to say. Okay, let's start with a very basic question. Obviously, we've all come together to discuss sleep disorders, but why is it important? Why should we even be discussing sleep disorders? Is it something that people are interested in? Does it affect a lot of people? What's the key reason for us to be discussing this? So I'm going to turn first to Glynes, and please ask you for your opinions.
Well, obviously there is a need to discuss, explore and elaborate on sleep issues for all sorts of people with this condition. You call them sleep strugglers, which I love. People don't really appreciate how much we do need sleep and how beneficial it is to us in our everyday life and the way that we go about our work, the way that we relate to each other, our wellness, our sense of being. So I think that's why it's important to have this group, to explore, to see how far other people have gone in exploring the issues and to exchange information, etc.
I understand. Can you just very quickly give a sense of how many people suffer from sleep disorders? Is it a large percentage of people, a small percentage of people?
I don't have the statistics. I wish I had, but from my own experience, most people come to me particularly for stress-related issues, diseases, cancer, for instance. And underlying all of that, of course, the sleep is disturbed. So I would imagine it's over quite a large part of the population in the world.
Understood. Dr. Kushnir. I'm going to ask you the same question. Why is it so important to discuss sleep disorders? Does it affect a great number of people? Please.
Okay. So first of all, I think the most basic thing is that sleep involves everyone. I haven't heard about anybody that doesn't sleep. Maybe you have. So it's a basic human skill or a basic human need, of course, like hunger and thirst. Second of all, statistically, I think the statistics show that about 9% of the population will meet a sleep problem. And when I just want to stress that we have to differentiate, and it's very important, between more biological sleep disorders like sleep apnea or restless leg syndrome, okay, and between more like psychological sleep disorders like insomnia, okay, or nightmares, etc. So regarding insomnia, as I said, about 9% of the population can suffer from it at least once in their lifetime. Okay, another data shows that that about 50% of people that suffer from insomnia also suffer from other psychiatric disorders. Okay, another fact is that the impact of insomnia, chronic insomnia, and not a short-term insomnia, can be, I don't want to say devastating, but can have very negative effects on our well-being, our mood, our functioning, social abilities, social interactions, and our daily life, actually. And people try to use all kinds of patents or safety behaviors, which we call that in CBT, to try to handle the problem. But what it does for the long term is that it only perpetuates the problem.
I understand. I want to take just a moment, and I want to thank Anna. She's actually drawing a graphic representation of this entire webinar. She herself is truly an art designer, and we want to thank her for her time. So I think it's fair at this point to say that sleep disorders are quite common, and from what I've understood, they really do interfere with people's day-to-day function, and they can be very intrusive. I know I've experienced such sleep disorders, and it's had that effect on me. Now, I've heard that a lot of people think that the problem with sleep is just that people have too many thoughts. Their minds are racing, and they just can't seem to calm down. Now, I'd appreciate to hear your opinions on how important that is, how real that is, if that's really one of the reasons, and if so, how can that be dealt with? Glynes, could I please ask you?
Of course. It is one of the reasons, but it is only one of the reasons. Mm-hmm. But if people's minds are racing, then they need to become more in control of their thoughts, of their breathing, for instance, to bring them back into equilibrium. That's easier said than done, because habits form, and people get to a point where they think nothing will help, and then feel desperate that there doesn't appear to be a way out. So yes, racing thoughts are one of the issues that people do face, and that's where my line of work does come in, because of teaching self-hypnosis and things like that can help that area.
Thank you. All right. May I ask Dr. Kushnir?
Yes. So again, there is a great variance between people. But as in other disorders like panic disorders or anxiety disorder in general, from my point of view and the CBT point of view, the most important thing is to try to understand the things that perpetuate the problem, okay? Mm-hmm. And this can be both things that are done during going to bed and staying in bed, and also during the day. And if you want, I can get into several examples of that. And at the end, sorry?
If you could give us a couple, we'd appreciate it.
Yes, no problem. Okay. So one example is that, let me start by the boss of insomnia that stands here on the head. And that's what's called losing sleep about losing sleep. So if I have a conception that losing sleep is devastating, or if I have a thought that I have to sleep, for example, for 8 hours, otherwise hell will break loose, then I create the ground for the anxiety to rise. And when the anxiety rises, then I have racing thoughts in one hand, and on the other hand, my physiological system works for overtime, okay? And actually, sleep is one of the only things in life that you don't have to do anything for it to come, right? The more we try to bring it more, stronger to us, and we try to say, I have to have you, it will go away. Okay, so one of the most important things is I don't want it to sound like a cliche, but to let go and to try to understand what are the things that I'm doing. For example, watching at the clock every 2 minutes, okay? Thus creating more stress. Another domain is what's called energy conservation.
Dr. Kushnir, if I may,
yes.
I definitely want to hear the second point, but I would like just to turn back to Glynes.
Okay.
I'd like to ask you, Glynes, how often do you find that racing thoughts really are a key problem, and how successful are you in helping people control that?
Large majority, as I say. At the moment, I'm working with a support group for fibromyalgia, and that is a vicious circle of, as the doctor has said, that you know, they worry about the lack of sleep because they've got to get up tomorrow to sort out the day and the pain levels and things like that. And with cancer clients, they're worrying about lots and lots of different things, not just the cancer itself, but the treatment, their families, their finances, just lots and lots, you know. So underlying a lot of my clients, stress management coming from a job, redundancies, all sorts of things. So racing thoughts are you know, a large part of it, absolutely. And how I deal with it is that I teach breathing exercises, I teach self-hypnosis, but I'm also asking them to look at changing little things to make big impacts too. So the way that they live in the day, the way that they prepare for bed, what they do in the bedroom, excuse me, but not having TVs and, you know, electrical equipment around them all the time, and those sorts of things really. So education and tools that they can use that can empower them.
Understood, understood. Dr. Kushnir, please, if you wouldn't mind, could you continue to the next example you had?
Okay, another example is that if I'm so afraid that that by not sleeping I will lose energy and that can have a negative impact on my life, I am canceling appointments, I'm not going to work, I'm not seeing friends, but again, that's a vicious cycle, as she said, and what's happening is that I'm not tired at night, okay, and that's one thing. The other thing is that I'm not enjoying life, because I don't see friends, okay, I don't act in a day-to-day activity that I used to enjoy, and that's a very good recipe for depression, okay? Other examples is trying to stay in bed in order to fall asleep, okay? It's like when you get stuck in the mud with your car, and you just hit the gas pedal more and more and more, and you just you stay stuck inside, okay? So what we want to do, and then of course you have the racing thoughts, okay? And what we want to do is, first of all, to have awareness of that process, and then help people to stop doing what is perpetuating the problem and creates the vicious cycle.
Understood. Again, a quick question. I do appreciate, and also from my own reading, that insomnia or difficulty sleeping can come from a whole range of sources. So, nevertheless, when people come to you, I'm sure that they have certain specific questions, and you need to have answers for them. If they come to you and they're asking, listen, I just can't sleep. So I imagine the first process is trying to understand why, and then giving them tools to help them. And I assume that's even regardless if they have, as you've mentioned, some type of disease or some type of other physiological problem interfering with their sleep. So basically what I'm asking is, how do you answer those questions? When someone says to you, why can't I sleep? How do you deal with that question? How deeply do you go into the answer? And then how do you work out with them what your treatment is going to be? Because in other forms of medicine, often the treatment is very closely tied to the diagnosis. But I get the impression it's a little bit different in this case. So Glynes, when people ask you, why can't I sleep? And how do you answer that question, which I'm sure is a very hard question to answer?
Okay. Can I just say a little story before that?
Sure.
The Eskimo community, when they meet each other, one will say, it's good to see you. And the response that they get often is, it's good to be seen. In my practice, I try to say to people, it's good to hear you, and I want them to say, it's good to be heard. So, to answer your question, why can't I sleep? I would have to say to them, I don't know, why can't you sleep? Let's explore this together. I am not a guru. Everybody is different, and I believe people have their own answers deep within. They are the experts on their lives. I have some expertise on some of the tools and techniques and training that I've had, but they are the experts on them. So we'd explore with them. When I meet with a client, I meet with them for 2 hours. So we explore for 2 hours, hour and a half, and then we do some hypnosis, and we set a plan, etc., for the next sessions. If we've found a trigger or an initial event that has caused this to happen, but for some people it is just bad habit. They've just stayed up later and later and later, and now lives have changed and they want to go back to what they consider normal, and they're finding that very difficult. So it is, saying to them, how are you living, and how do you want to live, and how do you want to get there, and how fast do you want to get there? Because, some people want to go very slowly. Some people want it now, and I haven't got a magic wand. It's about them and how they look at their situation.
When they ask you about their sleeping disorder, do they ask as following, I can't sleep? Or do they say to you, I'm stressed and I can't sleep? Or I'm troubled and I can't sleep? How do they phrase the question?
Yeah, some people come and say, I can't, I'm having trouble sleeping, I'm not going off to sleep easily, or I'm going off to sleep okay, but I wake in the middle of the night and I can't get back to sleep. I have some people who say I get up when that happens. I have some people who say I just stay in bed and let it worry me all night. Everybody is different. Really, I can't say how people come, but first off, they must have been to the doctor to find out if it isn't a physical condition. That something underlying isn't happening, because that's not my area of expertise. Sure. Once that's clear, then we can start looking at how to go forward. It's good to look back, but only for the learning and not to live there. It's to go forward and move into their new, powerful, empowered, wonderful future where they're in control of their lives, their sleep.
Excellent. Dr. Kushnir, so I'll turn to you with the same question. So how do patients present to you? Do they complain of being just having difficulty sleeping, or do they give other complaints that in fact are masking their sleeping problems? How do they come to you?
Again, the variance is enormous. I agree completely with your answer. You have to explore. Of course, it's like someone coming to you and say, I have pain, and pain can emerge from several reasons, of course. A very thorough interview intake is very important, of course, to rule out medical problems and rule out other diagnoses. And usually, what I find is that insomnia is a problem. But as I said before at the beginning, there are also other anxiety disorders, for example, like OCD, obsessive compulsive disorders, GAD, generalized anxiety disorder, post-trauma. Okay, and then you have to formulate the problem and understand how you're going to treat it. And sleep is a part of the treatment. Second of all, many times, and that's very interesting, a patient comes to you with a complaint about an anxiety disorder or depression, and sleep is something that is in the back. And I always ask about sleep, and he said, "Oh yeah, I also I don't sleep well." And of course, it enters the stage, and it becomes a part of the treatment. Because as we can see, for example, research shows that a person that doesn't sleep well, it will affect his anxiety disorder. Other studies show, we just published recently a study that shows that if you treat the anxiety disorder alone and the person has a sleep problem, it will not treat his sleep problem. So you also need to treat the sleep, to put a sleep ingredient in the treatment.
Well,
maybe I took it too far, my answer, but
no, it's very informative. Thank you. I have a pointed question which speaks to the way people deal with their sleep disorders before they seek help. This time I'm going to start with Dr. Kushnir. How many times do patients come to you where they've already tried a quick fix? I made Glynes laugh, so I guess that's I can expect a very interesting answer from her, I'm sure. So Dr. Kushnir, so I'll start with you. So yeah, the
most prominent sentence is "I tried everything." I tried everything. That's the number 1 sentence. Okay, a lot. The answer is a lot. It's simply said, a lot of people say that.
So they're coming to you as a last ditch effort, the last line of defense. So that's a lot of pressure. That's a lot of pressure on you. You have to deal with people who really are at their wits' end, and they're coming to you and saying, "If you don't help me, I've got nothing else." That's very difficult.
Yes, but I stressed at the beginning that I'm not a magician, and I will do my best, of course. I have to admit that most of the time that I don't feel pressured.
Okay, Glynes, now you have to tell us why I made you laugh.
Because I agree with the doctor. You know, as a hypnotherapist, I am the last port of call. I am their last resort. They tell me tried everything. Although when you seek with them what they've tried, they really haven't tried everything. But you know, you say there is pressure, but that is only if you're invested. I couldn't do my job properly if I was too concerned about the outcome. I can only be there with that person at that time as fully and as completely as I can be, with the tools and techniques and the training that I have to help them in the very best way I can. People do show despair when they haven't an answer, but often also, as the doctor mentioned earlier, that it's often about perception.
I understand, but I'm sorry though, I appreciate you saying perception, but a perception of what? A perception of your ability, yeah.
Yeah, no, how they're feeling so desperate. You are their last port of call. But I was speaking yesterday to someone, and Margaret Thatcher, not to get political, she said she only had 4 hours sleep, and she says she managed quite well. The jury's out on that, but people sometimes think they have to have 8 hours sleep, and get very distressed and distraught when they don't have 8 hours sleep, but actually maybe for them 7 hours is adequate.
I understand.
Perception about how much sleep they have, what it's doing to them, expectation of how they should be living their lives, how they should be feeling at any one point in time.
I understand. Dr. Kushnir, do you find that simply telling a patient that sleeping less is acceptable as long as they're rested, that they shouldn't be trying to attain something in terms of sleep hours?
I don't understand the question. Can you please?
Sure, I apologize. I'll restate it. People come to you and say, I'm just not sleeping properly. I'm not sleeping well. My question is, do they ever come and say, listen, doctor, I try to get 8 hours of sleep a night and I just don't succeed. I'm up after 6 hours and I just can't go back to sleep, because they think they have to be asleep in bed 8 hours. Do you ever find that just telling them that 6 hours of sleep is enough, if that's enough for them, helps them?
Hardly.
Hardly.
Because
Okay.
that's again part of the misperception. One of the basic cognitive distortions or misperceptions in insomnia is the absolute need to sleep a specific amount of time, because and what I asked them, is there a specific law written somewhere that you have to sleep 8 hours? Okay. The same thing is for parents that come to seek help for their children sleep problems, and sometimes actually quite a lot you understand that there is no sleep problem. It's a misperception, because they understood that their child has to sleep 13 hours from the age of 1 month. So you, of course, you do a lot of work on their misperceptions.
Well, that's an incredibly important point. Glynes, we made you laugh again, so I know we touched on an important point.
I think it was exactly as I was saying, that people believe a certain thing, and if that doesn't manifest in their lives, they're upset, they're distressed, they're looking for an answer. They think they want that, whatever that is, instead of looking at themselves and saying, what is it I need? Do I need 8 hours sleep? Do I need to lie here punishing myself to get to sleep, or am I okay? Of course, if lack of sleep is disrupting their day, their relationships, their work, of course that needs to be addressed.
Right.
But I think the first thing is to find out really what is their sleep pattern and how much do they actually need.
Okay.
Or one of the first.
Right. We're actually, believe it or not, we're actually starting to come almost near the end of our time. So I want to maximize. I want to try sneaking in some extra questions. I know that from my classic training in medicine, sleep disorders were basically never discussed. And I'd like to know, how often is it that people have spent a great deal of time with their physicians, and their physicians don't even think of recommending going to a sleep specialist to help them with their problems? I'm going to start with Dr. Kushnir, because that means I give Glynes the chance to finish off and make the grand statement. Dr. Kushnir, please.
First of all, it's a matter of awareness. Again, as everything.
But doctors aren't aware. But doctors are not aware. They're not. They really aren't.
No, there are actually several research also saw in pediatrics about pediatrics that are not aware of sleep disorders of children. So if I'm not aware of something and I'm not looking for it, of course I won't be able to recommend going to seek treatment. The other thing that there are a lot of physicians who are aware, but they give sleeping pills or benzodiazepines. Okay, and again, as other anxiety disorders or other disorders, and okay, so take it. And I have patients that go to their family physician and they take medications for years and years without trying any other solution.
Well, I can tell you that was a basic principle in medicine: better life through chemistry. If you can take a pill and make it better, then you've done your job. Glynes, our grand finale, please.
Our grand finale is that people are people, and GPs are people, general practitioners, doctors in my country, and they are general and they don't always know. So it is groups like this that will educate people to start looking at their lifestyles and reaching out for different answers instead of just taking the tablet.
I understand. Okay, well, you answered too quickly, so now I'm going to ask one last
I'm sorry, I just want to stress,
please, Dr. Kushnir, please.
I just want to stress that, of course, sometimes you do have to take sleeping pills, okay? But not automatically. That's very important. I mean, I'm not dealing with drugs or medications, but I just don't want it to sound as I'm saying that drugs are no.
No.
Okay.
Just say no. I understand. Just say no. So, okay, as it turns out, because we have millions of people listening to this webinar, I think it's an opportunity for each of you to give us one final message that you'd like to pass on to all those who are listening. So, Glynes, this time I start with you.
Okay. To all listeners everywhere, stop. Stop, breathe, think. Check in with yourself. What is it you need? What do you need to do about it? There's many answers out there. And as Doctor said, yes, sometimes it is a medication, but often it isn't. And there are many other groups that they can lean towards and get help from.
Okay, we have an intruder here.
Okay.
Hello, intruder.
I think that's
that's my sleeping pill.
Now we know, Dr. Kushnir, why you're having sleeping disorders. I understand. So Glynes, I think that's a marvelous way of summing it up. Just using a powerful term like that, stop. I think that's a fantastic way to pass on the message, in my own humble opinion, and I appreciate that. Dr. Kushnir, a final message to the world?
Yeah, that's the next generation. What I want to say that if you have a problem in general, don't try to avoid it. Of course, it means that you have to invest time and energy to solve it, but the price that you will pay, and actually that's something my GP told me, the amount of time that it will take me to help you with this problem will be twice the time you neglected the problem. Okay, wow. So...
A doctor said that?
Yes.
That's brilliant.
My GP
doctor said that.
Yes, for the past 25 years.
That's wonderful. That's wonderful. I want to thank the two of you. I want to thank Anna. I've been secretly watching her, and I for the life of me, I don't understand how she does this, how she creates such a thing just from thin air. But I really want to thank you, Glynes. I want to thank you, Dr. Kushnir. I know this has been incredibly informative for me, and I have no doubt it's been very informative for all our listeners. I want to wish you the best. I want to wish you a good night's sleep. All right? And thank you for your time.
Happy to participate.
Thank you so much. Really, thank you.
No problem.
All right. All the best.
Thank you very much. And
bye-bye.
I want to thank you as well, and I invite all the viewers to follow us, SleepASAP, on Facebook, Twitter, YouTube, and Google+. Have a pleasant night, everyone. Thank you. Thank you, Nachum.
Bye-bye.
Okay.
Maybe you have. So it's a basic human skill or a basic human need, of course, like hunger and thirst. Second of all, statistically, I think the statistics show that about 9% of the population will meet a sleep problem. And when I just want to stress that we have to differentiate, and it's very important, between more biological sleep disorders like sleep apnea or restless leg syndrome, okay, and between more like psychological sleep disorders like insomnia, okay, or nightmares, etc. So regarding insomnia, as I said, about 9% of the population can suffer from it at least once in their lifetime. Okay, another data shows that about 50% of people that suffer from insomnia also suffer from other psychiatric disorders. Okay, another fact is that the impact of insomnia, chronic insomnia, and not a short-term insomnia, can be, I don't want to say devastating, but can have
that we would like to go through, and I would very much appreciate Glynes's and Dr. Kushnir's responses, and really feel free to express your opinions. We really have a community that wants to hear what the experts have to say. Okay, let's start with a very basic question. Obviously, we've all come together to discuss sleep disorders, but why is it important? Why should we even be discussing sleep disorders? Is it something that people are interested in? Does it affect a lot of people? What's the key reason for us to be discussing this? So I want to turn first to Glynes, and please ask you for your opinions.
Well, obviously there is a need to discuss, explore and elaborate on sleep issues for all sorts of people with this condition. You call them sleep strugglers, which I love. People don't really appreciate how much we do need sleep and how beneficial it is to us in our everyday life and the way that we go about our work, the way that we relate to each other, our wellness, our sense of being. So I think that's why it's important to have this group, to explore, to see how far other people have gone in exploring the issues and to exchange information, etc.
I understand. Can you just very quickly give a sense of how many people suffer from sleep disorders? Is it a large percentage of people, a small percentage of people?
I don't have the statistics. I wish I had, but from my own experience, most people come to me particularly for stress-related issues, diseases, cancer for instance, and underlying all of that, of course, the sleep is disturbed. So I would imagine it's over quite a large part of the population in the world.
Understood. Dr. Kushnir, I'm going to ask you the same question. Why is it so important to discuss sleep disorders? Does it affect a great number of people? Please.
Okay. So first of all, I think the most basic thing is that sleep involves everyone. I haven't heard about anybody that doesn't sleep.
A lot that can be offered, and we want to discuss those options. I'd like to take a moment to introduce our two very special guest speakers. The first is Glynes Mewton, who is from North London, not Ontario, but I'm Canadian, but in England. And she is a multidisciplinary therapist. She is a specialist in sleep issues, stress management, and a long list of other things, all speaking to her truly broad skill set. I'd also like to introduce Dr. Jonathan Kushnir, who is a clinical psychologist. He's a member of the Israeli Association of Expert Cognitive Behavioral Treatment. So, thank you. I'd like everyone to, if I may, Ms. Mewton, Glynes, may I ask you just to say hello to all the listeners?
Hello, everyone, and thank you for having me today.
It's an honor for us. Dr. Kushnir, if you could just say hello to everyone.
Yes, hello, everyone. I hope everyone are well.
Thank you so much. We actually have a number of questions. We are on air. Hello to everyone. My name is Dr. Nachum Kowalski, and I have the honor of being the moderator today on the SleepASAP webinar. We have a number of guests, but I'd first like to say a few words about SleepASAP. SleepASAP is a new global community established by an international team of experts from multidisciplinary fields. We have come together in order to both promote awareness and to provide effective and affordable alternative solutions for sleeping disorders. This is beyond pharmaceutical drugs, This is beyond other potentially invasive procedures. There is